My name is Jim Krauss. I serve RMH as its president and CEO, and we're going to be speaking about aspects related to the new affiliation that we've announced with Sentara Healthcare. I've been asked, why is an affiliation like this good for RMH? It's very rare that we find an opportunity in a partner that shares our mission, our vision, our values, has resources in terms of size and capabilities, has great clinical outcomes. They are very advanced in terms of how they do continuous quality improvement. We can learn from them some of the things that we've done. They can learn from us. And I think that when you have all those line up in one partnership, you get great synergy that produces a great opportunity for improved healthcare for our community here in the Shenandoah Valley. I believe that this affiliation will have little effect to most employees. A lot of the decisions that will be made will be here locally by the local management team, by the local board of directors that we'll have. So as it comes to services and what we're going to add, expand, that'll be decisions from the local community standpoint. The affiliation with Sentara Healthcare will not affect the RMH Foundation. It will continue to be a department of the hospital, and all of the funds that it's received, past, present, and future, will continue to be dedicated to use here locally in our community. RMH will continue to be a community hospital. As we looked at this affiliation, we were interested in partnering with organizations that were similar to us. Sentara is a not-for-profit, community-based healthcare system, and so we're joining an organization that has the same fundamental principles that we live by. Up to this point, we've worked on a letter of intent, which both parties have signed. Next, we'll go through a due diligence phase where we get into more detail on learning about each other. That will ultimately end up into a document that's called a definitive agreement. In the meantime, there will also be some regulatory reviews, both from the federal perspective as well as the state perspective. And ultimately, we'll have a closing where the actual affiliation becomes official. Between now and then, it'll be business as usual. RMH is dedicated to open communication, so we encourage everybody to stay tuned. We're at the front end of this process. There's a lot yet to be done, a lot more things to be determined, and as we have that information, we'll be sharing it via our normal communication channels that we have in our organization. As I pause and reflect upon this momentous decision that's been made, I believe that people in the future will look back and see our board members as visionaries who took a bold step in doing what was best for the community's healthcare.